Achondroplasia is a genetic condition, more commonly known as dwarfism, that affects bone growth. Nearly 50,000 people in the U.S. live with this condition, and many have to work harder than others at everyday tasks. Dr. Clayne White is an orthopedic surgeon who specializes in treating this complex condition.
Achondroplasia is the most common form of short-limb dwarfism, and it results from a change in a gene that mediates growth in our skeleton, primarily in the arms and legs. And so individuals with achondroplasia, they grow to an average height of about 4 feet 4 inches for males and 4 feet 1 inch for females. But I think it's really important to recognize that while achondroplasia does affect height, most people with achondroplasia live pretty happy and productive lives. But for many tasks, they do rely on adaptive equipment for activities such as driving, shopping, and other forms of self-care.
And while those with achondroplasia can lead fairly normal lives, Dr. White says it's also important they get proper medical care from a very early age.
As infants, they can develop life-threatening spinal cord compression, and this actually can result in a higher incidence of sudden infant death syndrome. So for babies with achondroplasia, the SIDS rate is as high as 7%. And so this is something that needs to be evaluated very early in life, as soon as the diagnosis is made. As they grow, they can have some other complications with regard to their skeleton and frequent ear infections. And then as adults, the really most important problem is that they develop narrowing of their spinal canal, which can result in nerve compression. And this can require surgery, and if left untreated, can result in long-term disability and weakness.
And in his role at Children's Hospital Colorado, Dr. White has the chance to meet parents of children with achondroplasia.
I think most importantly, my job is to reassure them that while their child will not grow to be as tall as their age-matched peers, they will have a happy and active childhood. They should, however, given all of the issues that I've already outlined, be seen regularly by an experienced healthcare team.
And with that in mind, Dr. White says there are a number of resources for those affected by this condition.
First, I would always recommend that families check with their own local healthcare provider. Here at Children's Colorado, for example, we have a very robust website with educational materials and a list of families that we are willing to share, and those families are willing to share their experiences. Alternatively, you can go online and visit Little People of America at LPA Online, or you can visit risinglove.com, which is a resource provided by BioMarin.
All of these sites are terrific resources and outreach for those living with achondroplasia. I'm David Wiley for Coast to Coast.